I want to thank all of our witnesses as well for being here and the work that you do. I'd like to talk a little bit about telehealth beyond a typical office visit. As a former computer programmer and systems analyst, I have long been a strong advocate for telehealth and leveraging all this amazing technology to improve our access to healthcare. And so there are incredible ways that telehealth is serving patients in Nevada, even beyond the usual visits to the doctor's office. Cleveland Clinic's Lou Ruvo Center for Brain Health in Las Vegas, it serves patients with neurodegenerative diseases, including Alzheimer's and Parkinson's. During the pandemic, they've been able to move over about 90% of their clinical care to virtual or telephone visits. So all their patients, very chronically ill patients, can continue to receive care. In the cancer space, we've heard that doctors in Nevada are able to do their planning sessions virtually, not only with the patient, but with the whole family, anyone who wants to be there. So you have everyone on this video call participating in the patient's care as their support team. And no patient now has to push back their critical treatment because of their inability to go to the physician. So for the panel, we've heard some of the incredible ways that telehealth is being used, engaging Alzheimer's patients with virtual music therapy. We know that can help. The Nevada CAN program is working to provide wraparound services to our homebound seniors, keeping them safe through telehealth. They can call our 211 number right now through the pandemic. All seniors can and get triage and targeted help that they need, medical and social services. So besides standard office visits and chronic care management, we know they're critical needs, but how do we maximize the full potential of telehealth, and what barriers do you need Congress to still address both during the pandemic and beyond? So I know we all can't see each other, so I guess I'll start with Dr. Nadar, then Dr. Aurora, and Dr. Rubin.
Thanks for the question. You're quite right. Telehealth is a tool. So you can imagine if you have a set of tools in a toolbox, all the different utilization for it. And you've touched on a few, and there are many, many others. And that it really needs to be decided by the clinician and the patient as a team, what the best use of those tools are. And earlier, Dr. Rubin referenced specialty societies playing a role in those decisions. I think I would advocate for that as well. What can Congress do? Well, we've been over it, but just to reiterate, the originating site restriction should be permanently relieved. The ability for federal qualified health centers to be reimbursed fairly, rural clinics, and those things will help. And really, again, just being able to use the tool with the correct reimbursement and also the idea of having interstate commerce.
Wonderful. Dr. Aurora?
The biggest challenges I see, well, one of the biggest challenges I see for the healthcare industry are this explosive growth in knowledge. Till 2 days ago, what I knew about COVID-19 was actually proven wrong when a study from the United Kingdom showing that if you basically gave dexamethasone to a patient who was in the ICU, you can reduce their likelihood of death. This exponential growth of knowledge is something that is really, we have to deal with it head on. Because otherwise, without the right knowledge at the right place at the right time, it's impossible to get the right care at the right place at the right time. And therefore, I would encourage this body to use the telehealth technology not only for direct care delivery, but also thinking of our system, optimizing the system. For example, in the United States, we had a really great care delivery system for individuals. But when COVID-19 came along, we had no system response. We did not have an adequately working system that could respond to a community problem of this nature. And so using this technology to get the right information at the right place at the right time, mentor a healthcare workforce to work at the highest level of their human potential is an urgent need, especially to get care to the underserved people of their community who otherwise would have no chance for getting care, telemedicine or no telemedicine. because there's not specialty capacity in this system.
I believe I've run out of time. I apologize to Dr. Rubin. We'll ask our questions for the record and you can respond in that way. Thank you so much for all the work you're doing, and I look forward to partnering with you to bring more and more exciting technology to care providers and the patients and their families.